The ANSIScope monitor with ANSIStim provides objective scientific monitoring to improve P-Stim therapy and enhance the opportunity for cure. Chronic pain affects 116 million Americans. That's 1 out of 3 people. More than the total affected by heart disease, cancer, and diabetes combined. This pain costs the United States $635 billion each year in medical treatment and lost productivity. Acute pain is a warning signal that something is harming the body. In chronic pain, that signal keeps transmitting long after the attack has stopped. This is typically a malfunction that skews the autonomic nervous system toward the sympathetic and creates overstimulation of nerves as though the body is still under attack. ANSIScope from ANSIS can read this sympathetic information as shown in the display. This information is critical to effective therapy, especially while using P-Stim. The human auricle is a pressure point map of the human body. With the help of reflex points on the ear, it is possible to exert a selective effect on organs or regions of pain. The P-Stim, or point stimulation therapy, provides electrical stimulation to these auricular reflex points. The electrical pulses are transmitted through the dermis, along the nerve tracts and into the central lobe of the brain, where endorphins, the body's own opiates, are released. These endorphins are carried by blood throughout the body and inhibit pain. The reduction in pain increases circulation and muscle relaxation. After multiple treatments with ANSIStim, the patient's autonomic nervous system response will move towards the parasympathetic, which promotes body relaxation and pain reduction. Accurate measurement by ANSIScope improves P-Stim therapy. Systemic problems with the nervous system can now be effectively treated and measured. In most cases, prescription drugs, which only mask the pain, can be greatly reduced or eliminated. Administering P-Stim therapy takes approximately 10 minutes using the efficient and accurate measurement of the ANSIScope monitor. First, connect the ANSIScope to the patient using electrodes applied to the patient's inner wrists and ankles. Next, carefully clean and disinfect the skin in and around the ear in preparation for applying the electrodes and mounting the ANSIStim control module. Use the ANSIStim locator to select appropriate reflex points. Reflex points are locations that have the least amount of resistance to stimulation of free nerve ends. A low-pitched sound indicates high resistance. This is not conducive to ANSIStim needle placement. A high-pitched sound indicates low skin resistance. This is ideal for needle placement. Attach the ANSIStim control module with adhesive behind the patient's ear. Use the ANS monitoring function on the ANSIScope to monitor the patient's autonomic response to needle placement. The sympathetic response should rise after needle insertion, but drop close to the original value after several seconds. If the sympathetic response does not return, the needle location is not optimum and should be removed and reinserted into a new location. Repeat this procedure for each needle. This patient has 1 needle for chronic back pain and 2 needles for general pain. The ANSIStim generates electrical pulses over 4 days, alternating between 3 hours of stimulation and 3 hours of rest. A new ANSIStim is applied every week. The average patient usually requires 10 to 12 weeks of treatment. However, treatment can take as few as 4 weeks and as many as 20. P-Stim therapy is effective for all cases of pain where vagal stimulation is recommended. Weighing just 7 grams, the appliance is very comfortable and allows free mobility, including sports. P-Stim therapy reduces pain without side effects and has a far greater impact than standard acupuncture or permanent needles, and is reimbursable by most major health suppliers. Highly effective non-narcotic pain relief is now available through the combination of the ANSIScope HRV monitor with ANSIStim point stimulation therapy, P-Stim.